Savage, and we did our movie on Shutter Island and schizophrenia. The movie takes place in a post World War II America, and the main character, Teddy Daniels, arrives at a mental asylum as a federal marshal to try to find a patient who has recently escaped. As the movie goes on, though, we find that Teddy Daniels is in fact a man named Andrew Latis and is a patient on the island. And the psychologist on the island had created this experiment in a way to try to convince Andrew that his name, or that he really was Andrew, and try to bring him back to sanity. So the psychological disorder that Andrew experienced was schizophrenia. This disorder includes hallucinations, disorganized thinkings, and unusual behavior that Andrew displayed throughout the movie. While most individuals with schizophrenia are unaware that they have it, like Andrew in the case of the movie, and across different cultures, it's often interpreted differently because the context can change so much. But in the film, Andrew, he was diagnosed with schizophrenia. However, in other cultures, like I said before, these symptoms may appear differently and lead to different diagnoses. For example, it could be easily portrayed as like a psychosis or multiple personality disorder due to the epidemiology. Some of the stigmas that surround schizophrenia are seeing things and hearing things that are very different from reality, and the way mental disorders are diagnosed vary very much across cultures. Some of our evidence that he had schizophrenia was his hallucinations. So schizophrenics will have experiences that feel very real in the absence of external stimuli. He experienced auditory and visual hallucinations throughout the movie. Andrew did. For example, in one of the scenes, he was talking to an inmate on the island, and he saw his dead wife appear behind the roommate, and his dead wife began to speak to him, so he had both an auditory and a visual hallucination, even though obviously she wasn't actually there. More evidence was he had very paranoid and grandiose delusions. So paranoid delusions being that he believed others were trying to harm him as an individual, or he also had a very heightened sense of self-importance. So Andrew, he believed that Shutter Island was almost the American version of the Holocaust, and that they were experimenting on prisoners. He also believed that he was never personally going to be allowed to leave the island, which is a part of his paranoia delusions. And then he also believed that he was put in this situation to blow the whole lid off this place, or his words, to expose Shutter Island. That'd be very much a grandiose delusion of heightened self-importance. And then one thing that he did lack that most schizophrenics do have was disorganized or abnormal motor behavior. While his thinking was disorganized, his motor behavior was very much in tune. He scaled cliffs in the movie. He swam through very rough waters. And that's something that somebody with schizophrenia usually would not be able to do. And that's the only real thing that he displayed that schizophrenics do usually not have. So for treatment, medications like antipsychotics can be used because they block the dopamine receptors. This reduces the hallucinations that Andrew would have experienced, and in the movie we do find that he was on them for a time, and then he had withdrawals from them in the movie whenever they were running the experiment on him. Another option is a cognitive behavioral therapy, which allows the patient to understand their thoughts and why they're behaving that way, and, in essence, that they're having hallucinations. And this can allow for many coping skills to be developed and for the patients to, be able to live a normal daily life despite their hallucinations. These forms are very appropriate because, if you do both, it's a good combination between medicine and therapy. And while there are side effects of the antipsychotics, with informed consent and the patient knowing, then, ethically it's fine. And then one situational barrier that could hinder the character from receiving proper treatment is, for example, Andrew's, he's on an island. And, lots of stuff can happen on the island, although he was in the presence of, I guess it was a controlled experiment, but it's an island, so anything can really happen. So, for a more broader perspective, while this was not a completely faithful representation of schizophrenia, um, individuals with schizophrenia will tend to experience way more bizarre illusions, like aliens are coming and kidnapping you in the middle of the night. And Andrew's weren't as bizarre as that. However, I believe that this could be an artistic choice to allow for viewers to relate more to people with schizophrenia, because they want people to be able to have sympathy for people with schizophrenia. He also did not have diminished emotional expression, which is once again something very common with schizophrenics. He was very much an emotional person throughout the movie. I believe that movies on schizophrenia do tend to positively impact the view society has on schizophrenics, and then by extension, all psychological disorders, because most movies that do involve schizophrenia tend to humanize the individual and show that this is something that could happen to anyone. For example, in Shutter Island, throughout the whole movie, you believe what he believes, and the conclusions he makes seem more and more reasonable as time goes on. And even whenever the truth is revealed, you almost can't believe it. And so it makes you relate to Andrew in a way, even though he does suffer from schizophrenia. And then these are our references.